Welcome! In this short video, we'll cover what a Medicaid waiver authority is, how states use Medicaid waiver authorities for non-medical services, federal funding, both from Medicaid and other sources, and how Medicaid helps fund services connected to housing to improve care coordination, better service delivery, and improved health outcomes. Health services, when provided in tandem with a homeless or housing insecure person's non-medical needs, can support better health outcomes and lower service costs over time. First, let's review some fundamentals of Medicaid waivers. Imagine that you've been asked to help support an annual spring picnic potluck for your child's class field trip. As part of the day's fun, your child's homeroom teacher asked you to bring popular, easily packable snack options that your child may like to share with their friends during the field trip. Most importantly, the food options must be nutritious, easy to recognize, and fit inside their custom-decorated bento box, requiring intentional planning and sizing. In this video, the class event represents the United States landscape, and each child represents an individual state. Also, in our metaphor, each child's bento box represents different Medicaid-eligible providers, and the food inside each bento box represents various Medicaid authorities. The structure and flow of a picnic potluck is a great metaphor for Medicaid's programming structure. Like many other public benefits, Medicaid is an insurance program funded by the federal government through congressional appropriations of tax dollars. While the structure of Medicaid programs is longstanding, Medicaid allotments to each state, or, in the case of our metaphor, each child attending the picnic, is limited by congressional budget approval and is time-specific, meaning states do not receive Medicaid appropriations indefinitely. Each state receives a different percentage of federal funding for federal programs like Medicaid. This amount is traditionally called the Federal Medical Assistance Percentage, or FMAP. Once a state receives approval from the Centers for Medicare and Medicaid Services inside the Department of Health and Human Services, the state, or, in the context of the metaphor, each child, is approved to run several projects using Medicaid funding. Traditionally, Medicaid provides health insurance benefits and services for low-income people, people with disabilities, pregnant women, children, and those who receive another public benefit called Supplemental Security Income, or SSI. In recent years, states have had the opportunity to expand who they can serve through Medicaid funding. Medicaid insurance coverage for this group is called the Medicaid Expansion Group. For example, this may include young adults up to 26 years old without children. States can decide how they want their statewide program to be structured, which services are offered beyond federal standards, and who can receive Medicaid insurance coverage beyond federal requirements. This detail is important because different Medicaid waivers, or federal permissions, provide different types of benefits for different groups of people who are eligible for benefits and services within each state Medicaid program. For example, states can create a specialized insurance plan for children and youth who are currently or were previously part of their state's foster care program. Now let's learn more about what Medicaid does and doesn't traditionally allow. A Medicaid waiver is important because it allows a state to waive or bypass particular federal Medicaid requirements in exchange for a state-designed option that achieves the same goals as the standard Medicaid program requirements. Medicaid waiver programs offer varying levels of flexibility where states can modify and select the combination and types of Medicaid waivers that work best for them to achieve their goals. It's important for health centers to understand the key features of Medicaid funding because it helps leadership know how to potentially weave funding to provide support for beneficiaries using their services. Also, it's important for health centers to know where their potential service referral partners get their funding and the limitations of that funding. To be clear, Medicaid does not pay for housing, but it can provide important services for those seeking a place to live, especially for beneficiaries with low income and who were previously or currently homeless or housing insecure. Let's talk about some of the most common types of Medicaid waivers that a state will use. These include the 1115 waiver and the 1915 series waivers. When states decide which waiver programs to implement or change, they must consider several things, including who will be served under each waiver, how much the state expects to spend to serve these populations, and how long they expect the program to meet critical state and federal Medicaid goals. If a state is trying to create innovations that have not been tested statewide or across the region, it will likely consider pursuing what's called a Section 1115 demonstration. A Section 1115 demonstration is the most flexible of all current Medicaid waivers available to states. 1115 waivers allow states to pilot new benefits, create new service regions, and implement new cost-saving strategies to serve specific groups of people eligible for that benefit. 1115 waivers generally run for 3 to 5 years and must be renewed before the demonstration, or pilot period, ends. States generally pursue 1115 waivers to receive federal support for new innovations that have the potential to become part of the state's Medicaid state plan and broader Medicaid benefit delivery. The permanent Medicaid program is governed by a special document called the Medicaid State Plan, which is discussed later in the video. Section 1915 waivers are Medicaid program permissions governed by Section 1915 of the Social Security Act. Section 1915 programs are specifically designed to provide Medicaid services for children and adults with varying disabilities and who need ongoing long-term care with specialized medical and social supports. Grouped together, services for adults and children with these healthcare needs are called Home and Community-Based Services, or HCBS for short. HCBS services require a medical assessment and other criteria review that gauges what daily maintenance activities, or activities of daily living, an individual can do on their own versus without support. Is this individual at risk of going to a facility so they can access needed staff supports? Does this person meet the state's financial criteria to qualify for services? Does this person meet the program's other eligibility criteria, such as, is the person under 65, or do they have a chronic condition? And is this a service that this person wants to use, either in their home or in the community? Different Medicaid waivers or permissions have different rules around who can use which services, but all HCBS waiver programs must honor each patient's choice while minimizing service costs. When specifically focusing on 1915 Medicaid program waivers that may support homeless individuals or those with housing instability, states will commonly use two types of waivers, either a 1915C waiver or a 1915I state plan amendment. A state plan amendment is a special permission states use to make changes to their founding Medicaid document called the Medicaid State Plan. Each state has its own Medicaid state plan that defines what benefits different groups of people can receive in the state, and state plan amendments make important, long-lasting changes to that document. Although these special permissions vary in how they provide services, both 1915C and 1915I program options give states the flexibility of which HCBS services are offered, where they can be offered, and who can provide those services. Now back to our hypothetical picnic. Imagine, after passing around the small sandwiches and hand fruit, the chaperones point the children to a DIY dessert station. Like the dessert station, Medicaid participants pick which services under each program that work best for them. Beyond the other Medicaid sources listed earlier in the video, providers who serve homeless patients or those with housing instability may benefit from knowing about additional funding sources and service referral pathways for services provided by health centers. Let's explore these other sources further. Up first are Certified Community Behavioral Health Clinics, or CCBHCs for short. Similar to health centers, CCBHCs are required to provide a minimum set of services for people using Medicaid insurance with mental health or substance use treatment needs in exchange for Medicaid funding. CCBHCs are also charged with coordinating their patients' physical and mental health needs, regardless of ability to pay. CCBHCs are funded through planning grants made by the Department of Health and Human Services and certified by the Substance Abuse and Mental Health Services Administration. Depending on the size and location, health centers may get service referrals from CCBHCs in different parts of the county. Next are rural health clinics. Like health centers and CCBHCs, rural health clinics are another facility type that offers physical and other health services, in this case to people living in rural areas. Although the service restrictions and requirements vary, both rural health clinics and health centers can get Medicaid or Medicare payment bundles for services. Depending on the size and location, health centers may get referrals from rural health clinics in different parts of the country. Finally, there are government-issued grants. Block grants are a lump sum of money given to either states or specific local governments every year to run specific programs. Some health centers, specifically community health centers, are funded, in part, through an important grant program called the Section 330. Grants are awarded through the Health Resources and Services Administration, or HRSA. Other kinds of grants from different federal agencies include the Preventive Health and Health Services Block Grant from the Centers for Disease Control and Prevention, or the Community Mental Health Block Grant from the Substance Abuse and Mental Health Services Administration. These may provide funding to agencies that refer eligible patients to health centers if their programs do not cover needed services. Now you may be wondering, how do all of these various funding sources connect to housing services for homeless and housing insecure individuals? And how do all of these funding sources work together for health centers? Health centers need to understand the funding options within and beyond Medicaid that can pay for services they provide, and they need to identify other programs and partners that may refer homeless individuals and those with housing instability to their health center's services. While Medicaid coverage offers access to vital medical and non-clinical services, it generally does not pay for key processes and services that homeless and housing insecure individuals need to begin using services such as community engagement, member re-engagement, and other administrative activities between an initial warm handoff and when services begin. By understanding what Medicaid can and can't reimburse providers for, health center staff and leadership can make stronger and more meaningful connections to partners in the community that may have access to non-Medicaid funding sources for pre-service activities. Understanding the Medicaid service structure and flow in your state also allows health centers to prioritize vital services at the point when homeless and housing insecure individuals need it most. For more information, check out your state's profile on Medicaid.gov. Thanks for watching.